Hi, I would like to thank the organizers inviting me to this session. In this session, we will talk about endometriosis and how to improve IVF results with novel metabolic and antioxidant treatments. First of all, I don't have any conflict of interest according to this presentation. In the beginning of this presentation, I would like to share with you the problem of endometriosis, topography, and their consequences on the symptoms and on the fertility aspects. In stage 1 and 2 endometriosis, we have mainly superficial peritoneal lesions and minimal adhesions. In this kind of situations, we still have some problems of infertility associated with inflammation and high oxidative stress inside the peritoneum. In stage 3 endometriosis, we have mainly ovarian cysts and moderate adhesions or severe adhesions. And in this situation, we have mainly problems of infertility associated with diminished ovarian reserve. And in stage 4 deep lesions and severe adhesions, we have pain and high symptoms with high inflammation, and infertility would be the consequence of these situations. Oxidative stress in the middle of endometriosis, it could be caused by reactive oxygen species that may play a role in the development and the progression of the disease. We have increased generation of froth by peritoneal fluid, macrophage, and increased lipid peroxidation in patients with endometriosis. We have also diminished peritoneal fluid antioxidants and elevated oxidized lipoprotein and lipophosphatidylcholine. We have scientific evidence of oxidative stress in the peritoneal microenvironment in patients with endometriosis. What about the results of IVF in patients with endometriosis? As we know, we have, since Barnhart in 10 years ago, we have Arb and colleagues who published meta-analysis with clinical pregnancy rates in IVF patients according to the disease. And we find that in endometriosis, we have comparative results with controls when the disease is at stage 1 or 2, but at stage 3 or 4, IVF results would be diminished by about 10% as compared with controls. We are talking about IVF results, of course, and spontaneous pregnancies are diminished in all stages of endometriosis. So this oxidative stress in endometriosis is principally marked by elevated cytokines and VEGF. We have also significantly higher levels of cyclooxygenase COX-2 in these patients. And we have also some other peripheral blood markers that are enhanced in endometriosis. So multivariate analysis indicated that interleukin are the main principal markers of this inflammation in patients with endometriosis as compared to controls, as tubal factor fertility as an example. And we have interleukin 10, that is the most significant variable in this recent publication. We have also other publications that would concentrate on cytokines and interleukin 8, interleukin 6, and 10 also. So in these situations, we have also paired follicular fluid and serum samples collected from patients with advanced stage endometriosis. And we have concentrations of cytokines that are determined in these patients. And as we see, the results that interleukin 8 is one of the most important features for the score of inflammation in endometriosis. And we have also interleukin 10 that is also visible significantly. And we have other markers that we see. The VEGF is published usually in this kind of situation. And also we have interleukin 2 and 4. And we have prognostic markers of oocyte and embryo quality in women with endometriosis. And these prognostic markers would predict IVF success and will assist clinicians in patients' management. These markers would be ideally measured in follicular fluid, because follicular fluid is the immediate microenvironment in developing oocytes, and seems to be a good choice for identification of these biomarkers. In a review article, we saw that we have also differentiation in oocyte morphology in patients with endometriosis and who suffer from infertility, and could be related this kind of situation to the not only the endometrial environment, but also to this diminished oocyte quality. As mentioned in this review, we see that mitochondrial content would be lower in endometriosis patients, and we have dark central granulations as well, and we have spindle abnormalities and some change in time of zona pellucida hardening. So treating endometriosis aggressively by surgery, especially in stages 3 and 4, in order to have better results in IVF, would be controversial, because surgical excision like endometrioma and endometriosis cysts, ovarian cysts, would be harmful to the ovarian reserve, as we see in meta-analysis in 2012, showing a diminished or a decrease in AMH levels after cystectomy of about 1.45 nanograms. And other surgical situations like a deep infiltrating endometriosis would have not a beneficial effect on the pregnancy rates, and would prolong the time to pregnancy, as we identified in an earlier publication. So the role of antioxidants in animal models is very good, because we see that antioxidant therapeutics may offer promising way to prevent and treat diseases caused by excessive exposure to ROS, and deserve increased research, because it's a minimal invasive way to cure these situations and to have better results in IVF with endometriosis patients. Excessive oxidative stress in granulosa cells and induced cell senescence contributes to endometriosis associated infertility. And we see this in many studies with several markers that are diminished, and we have ROS species that are higher in follicular fluid, especially in these patients. What is the importance of L-carnitine in this situation? L-carnitine, as we have already mentioned, is a small molecule that plays a very important role in fat metabolism, and it is essential for normal mitochondrial oxidation of fatty acids and expression of acetyl coenzyme A esters, and would affect ATP levels. So L-carnitine would be helpful in increasing the energy of mitochondria and protect the cell from apoptotic death. So this reduction of apoptosis play a good role in helping cells and demonstrating anti-proliferative effect of TNF-alpha would be significantly reduced in the level of DNA damage in the embryo. So what is the protective effect of these antioxidants? Study 5 years ago, we had samples from follicular fluid obtained from 22 infertile women. And this study compared women with mild endometriosis to women without endometriosis, excluding higher age patients and higher body mass index. And we have, as in this study, a confirmation of a protective effect of antioxidants, L-carnitine and N-acetylcysteine, on the total number of mature oocytes in these patients. So this protective effect of antioxidants was seen also by fluoroscopy, and we have also upregulation of beta oxidation with L-carnitine. We have improved oocyte development competence with L-carnitine, and these beneficial effects are significantly demonstrated in these studies. So how L-carnitine may protect, reduce cell damage by increasing, as we said, the production of energy by mitochondria, increasing antioxidant potential, and protecting, stabilizing cellular membrane. And carnitine may protect also cell membrane directly against oxidative damage by capturing and removing toxic acid groups and stabilizing surface membrane. So we might have also other synergistic actions aiding membrane to repair processes. We have lots of clinical studies ongoing right now on in vitro fertilization and the effect of L-carnitine and other micronutrients in patients undergoing in vitro fertilization for PCOS or for endometriosis. And we are working on a study for the role of carnitine and antioxidant supplementation on IVF outcome. And we hope that we will have in the near future some results to present on this issue. And to conclude, supplementation with L-carnitine, acetyl L-carnitine, and other micronutrients could improve metabolism and hormonal profile, especially in endometriosis patients. It would improve, could be due to beneficial effect via mitochondrial energy improvement and reduction in ROS. And we need more clinical studies. Even though we have some good ones, we need more clinical studies to validate this improvement in female fertility and IVF reproductive outcome. And that's what we are trying to do right now. Thank you all for your attention. And I will leave the session for the questions. Thank you very much.